Okay, we're here with Ollie today, and Ollie's about to start her treatment with Dr. Davis. So, Ollie, tell me, how long have you had the knee pain?
For about 15 years.
And how did it start?
I went to a friend's house and missed a step, twisted my knee.
And what happened after that?
I had to have surgery. They said I had a torn ligament.
So you had a torn ligament in that knee.
Yeah.
And after the surgery, did it help?
It helped, but then it came back.
And then it came back. So you've been dealing with this for 15 years.
Yes.
Wow. I know we talked earlier. What is your discomfort level today?
It's a 9.
A 9. So those knees are really, really bothering you.
Yes.
Okay. And what do you do for a living?
I cook.
So you're on your feet 12, 14 hours a day.
Yes.
Oh my goodness. I don't know how you deal with that. Okay. So I know some of the things that's holding you back. You enjoy playing with your grandkids, and you're unable to do that because your knees are so bad.
Yes.
Okay. All right. We're going to do a couple different exercises. I'm going to have you just stand up for me. All right. Is there any discomfort when you did that, Ollie?
Yes.
And where is the discomfort? If you could point to it for me.
It's like under my knee.
It's underneath that kneecap in the front. Is it on both knees or just that?
Just that one.
Just that one? Okay. Next thing I want you to do is I want your arms straight out in front of you.
Both of them?
Both of them. And then I want you to squat as low as you can. Squat down.
Take a step.
Yeah, get away from the bench, huh? There you go. Squat down. And then slowly come back up. Now, where did you feel that discomfort?
In the back of my legs.
That was in the back, like the calf area?
Yes.
Okay. But not the knees. It didn't bother you with the knees?
No.
Okay. All right. The next thing I want you to do, Ollie, is go up and down the stairs for me. And make sure to hold on to that railing, okay? Okay, we're going to turn around and go back up. Now, how were those stairs, Ollie?
It hurt. They hurt.
Is it more difficult going up the stairs or coming down? Up the
Going up,
stairs?
Yes.
And where did it hurt?
The whole knee.
The whole knee?
Yes.
Okay. All right, so we got to get you back playing with them grandkids, and let's go see Dr. Davis. Okay, Ollie's finished her first treatment with Dr. Davis. So, Ollie, let's see what you can do. Can you stand up for me? Well, that's fast.
Yeah.
All right, let's try that squat again. Arms right out in front of you. How low can you go? Whoa. Wow, look at that. Slowly come back up. Wow. Now let's try the stairs. Saving the best for last.
With or without? Without?
Well, you can have your hand on the railing if you want, yes.
Well, let's see without.
Okay. Look at that. 1 foot at a time.
Yeah.
Yeah! Now we're going to go back up. And no assistance. It's all you. No wobble even.
Yeah.
Look at that. So, what have you noticed?
I noticed I have balance
Your balance is back.
and I have no pain.
You were a 9 when we started. What's your
Yeah.
pain now?
I don't have any pain.
Woohoo! That's awesome! Wow, that's great! Congratulations, Ollie.
Thank you.